That's important to have a good director and cameraman if you are actor. So, today we will have the biochemistry of nutrition. You will have about the nutrition 2 lectures. Today we will speak about the general parameters describing the nutrition, describing the energy in our body. And then we will speak about the basic macronutrients of our body. That means saccharides, lipids, and proteins. About the fiber, we spoke last lecture, so that we can skip, but you will have in the PowerPoint also. And then at the very end, I will tell you briefly how we can assess the malnutrition. That means what laboratory parameters we can use for assessing it. Then next week you have the lecture about the vitamins. So in that lecture we will go through the second part of the nutrition, that means the micronutrients, and we will focus especially on those fat and water soluble vitamins. So first, why do we need to have nutrients? The answer is quite simple, since they give us energy, plus they give us, or the nutrition gives us, the compounds that we cannot simply synthesize. So we can say that from the energy components, we have the macronutrients, that means saccharides, lipids, and proteins. And then in the diet, we have the compounds that does not give us energy directly, but we must have it for the normal function of our human body. So here we can name, for example, water, we can name the minerals, we can name the dietary fiber. As you know, we typically do not utilize this as a source energy, with some exceptions. And then we have the micronutrients, that means vitamins and trace elements. The last part, but that we do not count as the nutrition, for typically we do not eat it. But of course we need to have oxygen from the external environment, since the oxygen is used at the very end of the energy metabolism as the final acceptor of electrons from all these nutrients that we oxidize in our body. Not all compounds that we have in diet are essential to us. As you know, the difference between essential and non-essential means that non-essential compounds we can in our body produce. Essential compounds we cannot in our body produce. So for example, glucose is non-essential compound, since we have the pathways to produce glucose. For example, the gluconeogenesis from pyruvate or the gluconeogenesis from amino acids. But still, we have a lot of molecules of glucose in our body, in our new diet, and it's the main source of energy for our body. But the molecule itself is not essential to us, since we can produce it. For essential compounds, we typically name the vitamins. Majority of vitamins we cannot produce, or we can produce them in only limited amount, or our bacteria can produce it in some amount. And then we have from the macronutrients some essential fatty acids and some essential amino acids. You know that there are 8 essential amino acids and 2 main essential fatty acids. For saccharides, as was mentioned, we do not have essential compound, since we can produce the saccharides that we need for our body. If we look at the parameters that describe the nutrients, so the nutrition and the nutrients are oxidized in our body. That means that from saccharides, lipids, and proteins, plus oxygen, you produce reduced cofactors. And then these reduced cofactors enter the respiratory chain. And as the final waste products of our energy metabolism, we can name 3 basic compounds. That's carbon dioxide, that's produced predominantly in Krebs cycle. Then water, that we produce at the last stage of the respiratory chain. And then urea, that's produced in the ornithine cycle. Urea is the predominant way how to get rid of ammonia from amino acids. It, under physiological condition, represents around 90–95% of the amino nitrogen. But the small portion of amino nitrogen is excreted in form of ammonia also inside the urine. But the predominant form, if you should name, it's carbon dioxide, water, and urea. As you know, for energy, we can use 2 units. One is calorie, and one is joule. And we typically use it as the kilojoule. That means 10 to 3. And the conversion rate is that 1 big calorie equals 4.18 kilojoules. For us, it doesn't matter if you will, during the oral exam, during the credit exam, tell to us the numbers all in calories or in joules. Yes, you can use both, and also we can ask you on both. So that means that you can learn one list of values, and then simply you approximately multiply it, for example, by 3 or by 4 or divided by 4. Yes, this is absolutely up to you what you will choose. And these units we will use to define some parameters that will describe our nutrients. The first, the respiratory coefficient, is unitless, so there are no units. As you know, this is the ratio between the production of carbon dioxide from some unit over the consumption of oxygen. So you take a nutrient, you burn it. Do you want to have?
Sorry, it's fine.
You're welcome. You take a nutrient, plus you take the oxygen, and you know that after the whole metabolism, you produce carbon dioxide and the water. The water we do not count here, and for different nutrients we reach different ratio. That means different respiratory coefficient. Here you have basic explanation why from saccharides do we gain higher ratio than for lipids. This is a simplification of the chain of saccharides. That means, as you know, they are polyhydroxyaldehydes or polyhydroxyketones. And as you see here, we have 2 hydroxy groups bound to the carbon. As you see here, if we take in a theoretical way, here you can take hydrogen, oxygen, hydrogen, and you gain a molecule of water. And here you take the carbon plus 1 molecule of oxygen, and you gain carbon dioxide. That means that the consumption of oxygen is equal to the production of carbon dioxide. That means that per 1 molecule of glucose, you will use 6 molecules of oxygen, and you will generate 6 molecules of carbon dioxide. 6 over 6 means 1. So the respiratory coefficient for saccharides is typically 1. And it doesn't matter whether you burn fructose, galactose, or glucose. For lipids, the situation is more complicated. Here we look at a part of the molecule of fatty acid. And as you know, typically the fatty acids, they have the long carbon chain, where you have only carbon and hydrogen. Sometimes you have there the double bond. And at the very beginning, you have the carboxy group. But if we right now focus only on the saturated fatty acids and on the chain, you see the basic thing that here you must use the carbon plus molecule of oxygen. That's true. So you produce carbon dioxide. That's the same as here. But here you must add more oxygen. That means that the molecules of lipids are more reduced, and therefore more oxygen molecules must be used to oxidize them. And of course, for different fatty acids, the value will be different. It depends on the length, whether it's saturated, unsaturated, etc. And if we take an average, you know that it will be below saccharides, that means below 1, and the average value is 0.71. So that's the average value for respiratory coefficient under the aerobic condition. That means when you fully burn lipids, then you must consume more oxygen than you finally produce carbon dioxide. And therefore, since oxygen is in denominator, you must gain the value below 1. And it's 0.71. And for amino acids and proteins, of course, the situation is even more complicated than for lipids, since we have 20 or 21 amino acids that are inside the proteins. And you know that in different protein, you have different composition of the amino acids. So here, the average value for the protein is between lipids and saccharides. That means around 0.83. So it means that you must consume more oxygen to produce the carbon dioxide than from saccharides. Do you understand this? So then we come to the second parameter. This parameter you also should know from the previous year. That's the simple parameter that tells us what's the energy content in each nutrient. That means you take an ideal situation when you have precisely 1 gram of nutrient, you fully burn it, and the question is how many kilocalories or how many kilojoules do you release? From saccharides and from proteins, you gain very similar number. It's around 4.1 kilocalorie per gram of the nutrient. For lipids, you gain the number slightly higher, or not slightly, more than 2 times higher, since they are more reduced. Therefore, the amount of energy is there much higher, and the number is around 9. And then for ethanol, since it's not a basic nutrient, but as you know, the consumption of it's not low, especially in some socioeconomical groups, then ethanol is quite energy-rich compound, and from its oxidation you gain 7 kilocalories. That means that the people who drink ethanol, they typically do not have problem with energy, since ethanol is able to feed them with energy. But what do they miss are the essential compounds that are inside the normal diet. That means that if they drink a lot and they do not follow other recommendations of the healthy diet, they have the energy, but they do not have the essential compounds that are inside diet. Another thing is from ethanol you simply cannot produce saccharides. That means that they are also missing the carbon atoms for the production of saccharides. In your book, you can read for amino acids and proteins 2 numbers. The situation is whether we look at the ideal oxidation outside the body or inside the body. Since you know that amino acids are degraded in our body to carbon skeleton, that you can fully oxidize, and then to amino group, and the amino group is typically converted to urea. But urea, that's not the final step of oxidation. That means that if you will burn it outside the body, you will still generate some energy. But for our body, the urea is the final waste product, and therefore the value of oxidation of amino acids or proteins inside our body is lower than the potential value that you can reach if you simply burn them in calorimeter completely. So therefore, if you look at this incomplete or the on the complete oxidation, the value is around 5.3. But this is not valid for human body. This is valid only for systems that can fully oxidize the urea or produce some other form of nitrogen waste. Last parameter is energy equivalent. In energy content, you had 1 gram of nutrient and you fully oxidize it. In energy equivalent, you have, you can say, unlimited amount of nutrient, but what's limiting you is the oxygen. So you have 1 liter of oxygen. So the question is, how big amount of energy is released if you oxidize nutrients when you have 1 liter of oxygen? The average value for human body is 4.82 kilocalorie per liter of oxygen. And as you see, for different nutrients, the numbers are different. It's not surprising that saccharides has the biggest number. Yes, they have over 5 kilocalorie per liter. And as you know, the tissues that suffer from hypoxia, they typically prefer to metabolize saccharides, for they gain higher amount of energy when you are limited at the amount of oxygen. And then both lipids and proteins are lower. Lipids have slightly more, that's 4.55 kilocalorie, and proteins have around 4.31 kilocalorie.
If you higher the volume of oxygen, the ratios between the lipids and saccharides will change?
For this parameter, you cannot increase level of oxygen. Here is set for the measurement that you have 1 liter of oxygen. So I do not understand the question. You cannot here increase the number of oxygen. That's per definition.
Yeah, but like hypothetically, because like, we learned that lipids have higher concentration of energy.
Yes, that we said one slide ahead, yes.
Yeah, so you said it's obvious that the saccharides have the higher caloric per oxygen value. And for me it's not obvious. So
no, the thing is that if your body has enough oxygen, it's better for him to use the fatty acids. That's true. So if you have, for example, your skeletal muscle, they do not work, or they do a moderate work, they prefer fatty acids. That's true. They prefer it when they have a lot of oxygen, or enough oxygen. But once you limit in the tissue the oxygen amount, they will be more glycolytic dependent, since for their energy metabolism is better to consume glucose, for the result of the energy will be higher. So if you meant that if you double the oxygen, then of course it would be better for you to use the lipids. If you have enough oxygen, then lipids give you more. If you are not limited by oxygen and you are limited by the gram, then the lipids give you more. But if you are limited by oxygen, that means you have, for example, ischemic hypoxic tissue, then it's much more dependent on glucose. And typically, for example, the cancers, when they grow, they have very rapid growth, and they are not able to attract enough blood vessels to give the nutrition to the tumor. And typically, these rapidly dividing cells are much more dependent on glucose. So it's, from their perspective, when they are limited in oxygen, the best way how to gain energy if they could gain the glucose. If they do not have glucose, then they must use lipids or proteins, but then they, for the same amount of oxygen, gain lower amount of energy. If the cells are not limited by oxygen, then for them it's much better to use lipids. That's the most effective way how to generate energy. If you take the amount of nutrient. If you look at the oxygen, then saccharides are better. So another question. Have you heard about energy expenditure? What is it?
How much do you use?
Yeah, so that means there's the amount of energy that we consume per some defined time. So how many energy do we use? Typically, the period that we choose is 1 day, yes? And I think that all of you know that approximately is 8,000 kilojoules, yes? Or 8,400 kilojoules. So right now, we should about this discuss more detail, and I will try to show to you how, what are the basic components of it, how we can modulate it, and also how you can calculate it for your patients in some simple way. Since you know that the different people, of course, would have a different energy expenditure. So, per definition, there are 3 basic components of the energy expenditure. The first is the basal metabolic rate. That makes around 60%. Then you have the diet-induced thermogenesis. That means the energy that you need for intake, digestion, absorption, and utilization of the nutrients. Therefore, diet-induced. And that's around 8 to 10%. And the last is the physical activity. As I think all of you know, the physical activity would highly varies in different people. So if we take some strong examples, nowadays it's not typically normal that it makes around 30%. Yes, it was in past, but since right now, a lot of people do have a sedentary lifestyle. They work, means that they sit on the chair and speak to somebody or write something. Then right now it's much more common that the physical activity makes only around 17% of the energy expenditure. And then if you take somebody who's doing actively the sport or doesn't have the sedentary lifestyle, then you return to the 30%. If then you go to somebody who's really hardworking, so some worker, for example, then it can be even higher number, yes, than the 30%. And you will see in further years in the tables that for each profession, you have approximated the number of the calories that these professions utilize per day. And the more physical activity do they do in the day, then of course the higher portion on the whole energy expenditure is. And then the 8,000 kilojoules that are typically not valid, and they can have, for example, 11 or 12,000 kilojoules, these patients, or not patients, these people. First parameter is basal metabolic rate. As you heard in the name, it will have something to do with the metabolism and something to do with the basal metabolism. So we can define it that it's the amount of energy that we need to maintain the basal vital functions under the basal conditions. And if you want to measure it, then we have the standard procedure how to measure these basal condition and these basal metabolic rate. That means that the person must be in thermally neutral condition, environment. That means that, of course, if you go to low temperature, it will be stress for your body, and your basal metabolic rate will be quicker. The same if the temperature of the external environment is too high. Both high and low temperature means stress for you, and then it's not a basal metabolic rate. So that means it must be thermally neutral environment, and each person has it slightly different. Yes, the difference can be 1 to 3 degrees. Second is that you must be 12 hours after the last meal. That means that you exclude the diet-induced thermogenesis. It's the other component of the energy expenditure. That means that your GI tract without food will be in the idle state. and therefore no energy must be used to digest or to absorb the nutrients. And the third is that the patient must be in the total idle state. That means that, of course, no physical activity, but also no extensive mental activity. That means not to read a book, not to read a newspaper, not to speak somebody else, or not, for example, to look at some series. Since this is also some additional work that your body must do, and therefore it's not necessary for the basic vital function. So if you will fulfill these three conditions, and you will measure the energy consumed in the patient or in the person, you will calculate the basal metabolic rate.
How do you measure it?
That I will tell you later. How do you measure it? So these are the conditions. What we can say as the basic rules is that there are some factors that will modulate the basal metabolic rate. So typically you can say that it well corresponds to the lean body mass. What does it mean, lean body mass?
Muscles, not fatty.
Yes, so typically without the fat, yes. Since the fat, the obese person, they have high weight, but the adipose tissue is not so metabolically active in the consuming of energy. Therefore, it corresponds with the lean body mass. Plus, there are some factors that modify it. First factor is gender, since men have higher basal metabolic rate, yes, slightly higher. The same with age. You can say that the younger you are, the higher basal metabolic rate. The older you are, you know that you more slow down your metabolism. Third, as was already mentioned, body temperature, both high body temperature or low body temperature is increasing the basal metabolic rate, and then some hormone levels. I think that we have already heard the fact that people that have a lot of thyroid hormones, they have accelerated metabolism, and therefore they will have higher basal metabolic rate. Similar do stress hormones or sympathetic nervous system. So these factors typically accelerate the metabolism and accelerate the basal metabolic rate. Before we come how to calculate it, you can estimate it. And there are two ways how to estimate it. The first, very simple, and therefore also routinely used, but unfortunately not so precise, is this basic rule. So you take approximately 1 kilocalorie per person per kilogram per hour. So if we take it per 1 day, it means 24 kilocalories per kilogram. That's the simplest rule. If you are working as a doctor, they bring to you a new patient, and you must quickly assess what approximately will be the basal metabolic rate, since then you can calculate the energy expenditure, and therefore you afterwards can prescribe the artificial nutrition. You typically use this simpler rule. That means 24 kilocalories per kilo per 1 day. Second possibility is to use the Harris-Benedict equation. Of course, you do not have to memorize it, or if you would need it, you can find it in all books describing internal medicine or describing the nutrition, or you can find a calculator on the web. Only for you to see why the doctors really so likely use this formula, since they don't want to learn this. So basically the Harris-Benedict equation is quite old. It was established in 1918, and you must know 4 things. You must know the gender, you must know the age, and you must know the kilograms and centimeters of the patient. And as you see, you put these numbers into the formula, and from them you will gain the result that tells you what's the basal metabolic rate. Of course, this is much more precise than the previous estimation. And from today, you should remember the name Harris-Benedict equation, since it's really frequently connected with the nutrition of the patients inside the hospital. As you see, really, here the numbers are absolutely different, yes? Here we have big number at the beginning, for many you have small. So really, you do not have to memorize it. Only know the term and know when to use it. The result that you gain is the same as from the estimation. That means the kilocalorie per 1 day that the patient has the basal metabolic rate. And since the basal metabolic rate is not the only thing that makes the energy expenditure, the clinicians have this second formula, how to calculate from the basal metabolic rate, or how not to calculate, how to estimate from basal metabolic rate the real energy expenditure of the patient. And since it must be quite simple, you have only 3 factors that will be used to correct the basal metabolic rate or to convert it to energy expenditure. When you are in a hospital, the first factor will be the injury factor. Then you assess the activity of the patient, and then you assess the temperature of the patient. Here you have some basic rules how this is used. So you take the basal metabolic rate, you estimate it, and then you multiply it by some of these numbers. So first, if we start with injury factor, all of us that are sitting here have injury factor 0, you can say that means 1.0. So that means that we have no injury, therefore no modification of our basal metabolic rate. If you have a basic elective surgery, of course the injury is some stress to you, and you will multiply the basal metabolic rate by 0.1. And then, extreme situation, if you have the patient with a septic shock, that means in the generalized infection, that means when you have highly increased velocity of the metabolism, you multiply the basal metabolic rate by 1.5. So you see that plus 50% you add together only from the injury. Second is activity factor. Activity factor will be 1 if you do nothing. That means the bed rest. It means that all of us, we do something, so we do some physical activity, and therefore for outpatients or those who do active rehabilitation, that means that they must do some physical activity, they have higher. So they have around 1.5, the multiplication. And then you can have activity factor below 1, and that's if you have the artificial ventilation. In that time, you have the bed rest, but also the machine is working and helping you to breathe. Therefore, you do not have the voluntary activity of your breathing muscles, and therefore you can say your physical activity is lower. And the last factor, as we mentioned, is the temperature, and both increase or decrease of temperature is increasing your energy expenditure. And it's evaluated that each degree means 0.1. That means you start with 1.0 when you have 37, and if you have, for example, 40, then you multiply this number by 1.3. Then you do the same, for it doesn't matter if you go up or down. Both means that you want to produce or to lose the energy, so it means stress for you. And this is a very simple way if you have the patient where you cannot ask him something, how you can evaluate it. the energy expenditure, and then you can prescribe the nutritional interventions. So you estimate the basal metabolic rate, then you multiply it by 3 numbers. You will gain the final amount of calories that the patient should have, and at that time you will prescribe adequate nutrition for him. And this is very quick, elegant method how in few minutes you will know the approximately amount of the energy that you must give each day to the patient when the patient is not able voluntarily to eat and not able voluntarily to say, I have hunger or I am satisfied. So do you understand this? If you want to be more precise, and that was the question, how do you measure it? We typically measure it indirectly. And we use the method of indirect calorimetry. In that method, we use 3 values, and the machine will give us what's the energy consumption, what's the energy expenditure of the whole body. And what do we use is the consumption of oxygen. You know how many kilocalories this will lead to production, for you know the average value. Then you know then you will need to have the excretion of carbon dioxide. So you are able to calculate the respiratory coefficient, so you know what nutrient is used. And then you take the nitrogen excretion. And as you know, there is the value that approximately 1 gram of nitrogen equals to 6.25 grams of proteins. Of course, it's also some average. So from this measurement, the machine is able to calculate you, or the program is able to calculate you, what is the energy expenditure inside the body, how big amount of proteins do the patient burn or utilizes inside the body, and also slightly to distinguish what nutrients is preferentially used. If the respiratory coefficient is close to 1, you know that the major substrate is glucose. When it will be close to 0.71, you know that the major substrate are lipids. And then if you are somewhere in between, you can correlate from the nitrogen what is the role of proteins, and if you exclude the role of proteins, you know what will be predominant, whether the saccharides or whether the lipids. This you can do, but you must have the patient typically on the machine, on the ventilator, that will calculate it to you. You must have the 24 hours urea to know the nitrogen excretion, so it's much more complicated and it durates longer time. And therefore, for the first line, you will do the estimation, then you will correct it by those 3 factors, and you will know the result. It's only estimation, but better than nothing. So any question to this? So what we can ask you on during the exam or credit examination is, you have the patient, so this is the body weight, calculate what's the basal metabolic rate, and then here we have the activity, injury, and what is it. And you should be slightly able to say good how to calculate it, how to estimate it. So nothing difficult.
How is it with patients in coma?
Typically the patients, when they are in artificial ventilation, they have lower. For the machine is breathing for them.
Yeah.
But you know, it means what type of coma do you have? For you know, it depends where you destroy the brain. Some people are able to breathe spontaneously, some not. It depends what coma you mean. If you have the total reactive coma that the patients are not able to breathe, then you must breathe for them. And of course they cannot eat, so you must give them the nutrition by yourself.
But the metabolism is still active. And
you know, that depends what type of coma it is. Yes, you can have the liver coma when the liver encephalopathy is so severe that it will completely shut down the brain, then of course the problem is in liver, and the metabolism is different than if you have the coma due to poisoning, that the people took high doses of sedative drugs. So if you put these high number of sedative drugs, that of course you will suppress the brain function. So then will be the result different. They will have lower energy expenditure. Second very simple equation is energy balance or energy homeostasis. That's the equation between energy intake and energy expenditure. Till now, we have spoken about the energy expenditure. Energy intake, you calculate quite simply. You make a list of the food, then you convert it to the nutrients that are inside, and you calculate how many grams of each nutrient is inside, and from that you are able to calculate what is the energy intake. Typically, the food industry put them on the food, so you can read that if you eat this bar, you have so many calories. Or if you give the artificial nutrition to the patient, on the back you have written how many kilocalories do you have inside the bag. For the medicine, this equation has very simple result. If the balance is positive, that means that energy intake is higher than energy expenditure, it must lead to obesity. Therefore, if you want to treat obesity, you have two possibilities: to increase energy expenditure or to decrease energy intake. Second, if you have negative balance, that means that you are missing energy, then this leads to the malnutrition. And you can treat it by increasing the energy intake or by decreasing the energy expenditure. So if you are speaking to the patient that has the obesity, really you can write to him this simple equation and explain him that there is really no some miracle in the medicine, that simply it's only about energy intake and energy expenditure. So you can suppress the food or increase the physical activity. And also, majority of drugs do not have any long-term effect. If you use drugs against obesity, they have some short-term effect, but after many, many years, if the patients do not modify this equation, they will still return to the previous obese weight. In adult, we typically have the balance of the energy of this energy intake and energy expenditure. How is controlled? It's controlled by our central nervous system. It's the center for hunger and satiety is inside our hypothalamus. And as you will learn in summer semester, you can define the lateral hypothalamus and the nuclei inside, and the medial hypothalamus and the nuclei inside, and the lateral hypothalamus will be for you the center for hunger, and the medial hypothalamus will be center for satiety. So if you selectively destroy one of these centers, then you can produce an individual that has constant hunger or has no appetite. Of course, this you can imagine also in real patient when the patient has, for example, highly selective stroke that destroys only one of these centers. Yes, but it's really only the minority of the people that have this very rare condition. These centers, they catch the signals from the periphery, from the rest of the body. It's not fully true or not fully discovered what is really the main signal. And what do we know is that there is no one signal, but it's the mixture of many, many signals. For example, the nutrients affect the activity of the centers. The activity of GI tract also modifies the activity inside the centers. What you should know from today is that we have some hormones that modify the activity also. First is leptin. You know this hormone. This hormone is produced in the adipose tissue, and we can say that it represents the amount of fat store. That means the more leptin you have, the lower hunger you should have. Then, second, are the hormones of the GI tract. And in GI tract hormones, we have hormones that increase the hunger. That's, for example, ghrelin, that's produced inside the stomach if there is no food inside. Or we have hormones that suppress the appetite. And typical examples are incretins that are produced in small intestine. And these hormones decrease the hunger since they are secreted to your body after the food ingestion. So they are produced in a response of the presence of the food inside the small intestine, and they send the signal to the brain that there is the food inside, and therefore there should be no more hunger. So as you see, we have these 3 hormones, or 4, with cholecystokinin, that modulate the hunger, but that's not all of them. When you will go further this year, you will hear about other hormones, about other neurotransmitters and other ways. But we will speak more in detail about it in the CNS section. Yes, that means in summer semester. So today only know that there are some hormones from adipose tissue and GI tract that modulate the energy balance, energy homeostasis. So, question to this? So if not, then we will take the break till 45, and after it we will look at the nutrients in the diet. So we have 3 basic groups of nutrients. That means proteins, saccharides, and lipids. And we will right now review them. Before I start with it, important for you is to realize that all recommendations typically over time are changed. It means that in different books you can read really different recommendations. Some rules are quite old, some rules are quite new, and I do not know how quite often, whether each year, each 5 years, in each 10 years, but there is still some switch. Yes, when I was in my school, I experienced one of the switch when we started not speaking that lipids are so bad. Yes, so if we go past, then the theory was that the lipids are not so good in the diet to have in high amount. Right now, the definition is different. They should be in the diet, but we know much more in detail that different lipids modify the metabolism in different way. Therefore, also today I will more in detail the most in detail speak about lipids to show you why there is really important to take care not only on the final amount of lipids, but especially on the composition of the lipids you eat. And maybe then in your future life, you can be pretty sure that you will meet some other switch in the nutrition. Yes, for the food industry produces different type of nutrients, different composition, the people eat different things, and we still know more and more how do they affect, for example, the civilization disorders, the degenerative disorders, and these. So if we start with the proteins, they are at the last position from the point of view of the total energy they give to us body. So they typically represent 10 to 15% of energy intake, but that does not mean that they are not important. Yes, since in the proteins you have very big amount of essential compounds that you cannot produce. That means that the amount of energy is not so significant, but of course the total role is very, very significant. How many grams per day of proteins? The basic rule is around 0.8 gram per kilogram per day. At this number, you can read also some variations. Previously, it was slightly more. It was around 1 gram per kilogram per day. Right now, it's slightly lower number, but you can still see people that will have the number higher, yes? That are the people that have some condition why more proteins in diet is beneficial for them. One typical group are the people that are in reconvalescence after some illness. So in these patients, you will give actively more proteins to give them enough nutrients to repair the tissues and to have the proper recovery. On the other hand, there are people that they must have lower amount than this. And that are typical people that have some problem with kidneys or sometimes in liver, since they have lower ability to get rid of the ammonia from the body. So this is the average for the healthy person, 0.8 gram per kilogram per day, but for different person it can be slightly different. As you know, from the perspective of the metabolism, we have the carbon skeleton that can give us the energy, and it can give us also the carbon atoms for synthesis of glucose, that means saccharides, or the synthesis of triacylglycerols. That means if you eat a lot of proteins, more than you should, then these proteins are not stored in your body in form of proteins, also not in form of amino acids, but typically they are transformed to fat, and they are stored in the adipose tissue in the form of triacylglycerols. So your body is able to convert the excess of amino acids in the diet to storage fat. The fate of nitrogen, we already said this. Urea makes the majority, around 95%, and ammonia in normal healthy individual only about 5%. And the conversion rate between the nitrogen and protein you already have in the board. So you are able to calculate how high amount of proteins do you burn in the patient if you know the amount of nitrogen in the urine. In last year, when we spoke about amino acids, we defined the term nitrogen balance. So only for you quick repetition, that we do not have only energy balance, but also nitrogen balance. Here it means the intake of nitrogen inside the food, that means inside the proteins in the food, and the nitrogen losses, that means in the urea and ammonia predominantly. And if you are a healthy adult person, you typically have the nitrogen balance in equilibrium. That means that the intake equals the losses. And as you know, we can have positive nitrogen balance, for example, during the periods of growth of the children, and you have negative nitrogen balance. The basic example for this is the starvation or any stress condition. If you have some severe stress, then it will lead to the development of negative nitrogen balance.
And how about pregnancy? Is it like normal condition?
In pregnancy, you have very big growth of uterus, of the mammary gland. So typically the women, they add the weight and add, of course, the new proteins.
Okay.
And then the small fetus must grow to become 3 kilogram high individual, big individual.
So it's like stress or no balance?
You know, to pregnancy, it's not typical stress, but you have their production of some hormones that mimic the stress. For example, in some pregnant women, you have suppression of insulin activity due to these new hormones. So it's not a typical stress as we think, but you can say that fetus is the constant consumer of nutrition from the lady. And if the nutrition of the mother is not adequate, then the fetus will force the mother to give the nutrients. In that form, it will be the starvation and the stress. We are not interested for proteins only about the quantity, for Till now, we spoke about the quantity. What is also important is the quality of protein. And the quality of protein is, per definition, the proportion of the essential amino acids inside each respective protein. So the quality means only how good is the composition from the perspective of the compounds that we cannot synthesize. The other compounds that we can synthesize, for example, glutamate, is not so interesting for us, for we can produce it from alpha-ketoglutarate. But what limits us are essential amino acids, and from that perspective, we have some high-quality proteins. But really, you must take into account that this quality means only the composition of the essential amino acids and tell us nothing about what in this food we have together with this protein. For example, you can have there a lot of cholesterol inside, and then this cholesterol part is not good for us. But only from the point of view of the proportion of essential amino acids, we have as typically high quality proteins. We have the egg protein, we have milk proteins, and the meat proteins. Yes, they have the good amino acid composition. If you want to fully exclude these proteins from your diet, you can do it. But only in that time you must take into account that you typically must use a mixture of other sources of proteins to supplement the problem of or the deficiency in some essential amino acids. So if you want to be a vegan, you can have absolutely no problem. Only you must take into account that if you eat only one highly specific food, it can lead to deficiency of some amino acids. And therefore, you must much more think about it, what is the proper composition of the food. But if you produce a good mix from different sources, you are able to gain the amount of essential amino acids that you need. Why do you think that these proteins have so high quality proteins inside? Egg and milk, for example.
Designed for building up like a child of some sort.
That's the explanation. For if you start with the egg, there must be a small bird formed from. That means that there must be the amino acids to build the whole animal. The same milk is typically the only source of food for the mammals at the beginning of their life. So it's quite logic that the proteins inside would have the amino acids that you need. So therefore, it's quite simple how to remember it. Yes, these proteins must give enough essential amino acids as the only source of proteins in some periods of life. And therefore, they are so good in giving us the amino acids that we really need. Any questions to proteins? Lipid. Lipids are quite complex group from the point of view of the nutrition. If we take the first, the sum, they should make around 20 to 30% of energy expenditure. And we can say that their importance is growing last 10 years. As you know, they have high amount of chemical energy inside, so that means that relatively you can eat low amount of proteins, a low amount of lipids, and they will give you a lot of energy. Inside lipids, we have two essential compounds that our body is not able to synthesize, and that's the omega-6 linoleic acid and omega-3 linolenic acid. These fatty acids are in our body used to produce other acids. For example, from linolenic acid, you produce eicosapentaenoic and docosahexaenoic acid that we will mention later. And from linoleic acid, you produce the arachidonic acid. So that means that we can use these fatty acids to produce some other compounds that are really beneficial for our life. And if you do not have these compounds, that you also will miss the products that are produced in our body. Before we come to the fatty acids, we will say a few words about the cholesterol. If you remember from the last year, recommended daily intake is around 300 milligrams of cholesterol per day. Nowadays, it's typically 600 milligrams a day. As you know, our body has some possibilities to reduce the second source of cholesterol, and that's the de novo synthesis of cholesterol in your body. But if the higher intake of cholesterol durates for a long, long time, it's one of the factors how to develop hypercholesterolemia. And hypercholesterolemia is the risk factor for developing cardiovascular diseases, as is atherosclerosis, and its complications, so myocardial infarction, stroke, etc. Where you can find the cholesterol? Cholesterol you can typically find in the same source that has high quality proteins. So you can find it in egg, in milk, and in meat. Why do you think that these two things are taken together? Essential amino acids plus cholesterol. That's true, to some extent hormones, but there is some other much bigger reason.
Membranes.
Yes, if you want to build a cell, you must have cholesterol for the membranes. That means if you want to build a body, then you must have cholesterol inside. Since animals, they have the cholesterol inside. They are membranes. So therefore, they are coupled together. And for the growing individual, both of them are very, very important. Unfortunately, if you eat 10 eggs a day, then you are not to be healthy in next 20 years so much. Yes. So in one egg, you have around 150 milligrams of cholesterol.
But it's like different if you have LDL or HDL, and isn't HDL like good to have?
But this is not HDL. This is the cholesterol, and HDL is only the particle.
Huh?
HDL is only the particle that carries the cholesterol.
Yeah.
And this is the cholesterol molecule itself. So it's good to have cholesterol in good particle.
Okay. Yeah.
But here this is the quantity point of view. So if you have a lot of cholesterol in your body, then predominantly it will be in LDL and not in HDL. Since if you have a lot of cholesterol in the diet, it will be carried by chylomicrons to liver, and then from liver to the rest of the body by the LDL particle. HDL is produced to take the cholesterol from the periphery to the center. But if you have high intake of cholesterol, then it must be transported first by the LDL to the body. So if you have high cholesterol, typically you have high LDL, and that's the bad particle to have.
I read that eggs increase your HDL, but it might just have been...
You know, that depends, that each food can depend. And in egg, very big problem is if you take only the protein is excellent, but you do not take and eat so many of the yellow thing. So the problem is the yellow thing, and there is really high amount of cholesterol. In each egg, you have half of the daily dose. So if you eat 8 eggs a day, it doesn't matter whether there is some beneficial effect of the fatty acids inside or of the protein inside. Unfortunately, the amount of cholesterol will be so high that it must be utilized somehow in the body. And problem is that if you have high LDL, they circulate a lot in your body, they will be oxidized, and that's the first step for the atherogenesis. So eggs are healthy, but you should not eat a lot of the yellow thing inside. Unfortunately, it's more tasty. And you know, you can read in things many. So to the fatty acids. First are the saturated one. Saturated fatty acids are, from the modern perspective, not very good. In saturated fatty acids, we can distinguish 2 groups. Lauric, myristic, and palmitic acid, they are really bad. They worsen the lipid profile. They increase especially the pro-atherogenic particles LDL and VLDL, since they lower the activity of the LDL receptor. That means that these particles stay for a long time in the circulation. Therefore, they are more prone to be oxidized. And the oxidized particles, LDL particles, will start to be consumed by macrophages and start the atherosclerosis process. Other group, that's stearic, that means C18, and short-chain fatty acids, that means lower than 6, they have no effect on cholesterol level. So if you have fat that's rich in stearic acid, it's not a problem. Problem is when you have fat high in lauric, myristic, and palmitic acid. Altogether, these saturated fatty acids you typically can find in the animal fat, or you can find it in coconut and palm fat. And since these fats are quite cheap, they are very often incorporated in the food industry into many things where you do not imagine these fats to be. So typically, a lot of cheap ice creams have these fats inside. And you think that the ice cream must be only from milk, but then if you look at the ice cream, you will read that there is the plant fat. And you can be pretty sure that it's this type of fat. As you know the story about the Nutella, in Nutella you have also these good fats. Therefore, we call them hidden fats, for typically people do not think that these fats are inside. And since we know that they are not good, you should prevent eating them or minimalize to some extent. But it's not true for all saturated fatty acids. Some you can have in the food, some you need to have, but if it could be the stearic acid, that would be the best. Then monounsaturated fatty acids. The main representative of monounsaturated fatty acids is oleic acid. As you know, olive oil is for quite a long time called as a good oil, and that's due to the good composition of the fatty acids inside, and it has the big portion of the oleic acid inside. The same is the rapeseed oil is not so ideal, but also quite good amount of oleic acid. What's good on these acids is the combination of two qualities. First is that they improve the lipid profile. That means that they reduce the LDL level. On the other hand, they slightly increase the positive particle, that means the HDL level. And second important thing is that these fatty acids are not so favorable target for the oxidizing. When we will go to the other group, that will be polyunsaturated fatty acids, they can have maybe better effect, but also they are more vulnerable for the oxidation. And the difference between monounsaturated and polyunsaturated is 10 times lower. So even when this effect is maybe not so positive, as for example for omega-3 fatty acids, in conjunction with the resistance to the saturation, to oxidation, they are very good fats. And as you will see at the very end, right now the recommendation says that the highest amount should be covered by the monounsaturated fatty acid, and especially those that are rich in the oleic acid. So olive or rapeseed oil. Polyunsaturated fatty acids. In polyunsaturated group, you have two subgroups. You have the omega-6 and you have the omega-3. Both of them are for our body important. Omega-6 is represented by linoleic acid, and as we have already said, this is the precursor for arachidonic acid, and therefore the precursor of important group of biological molecules called eicosanoids. And as you know, eicosanoids are important for inflammation processes, for blood coagulation, for the survival of the epithelial cells. So we must have this acid in the diet when we want to keep our body in normal standard condition. These omega-6 acids also lowers the LDL particle, but unfortunately there are two problems. First problem is that they are more prone to be oxidized. And second is that they share the enzymes with omega-3 subfamily. And if you compare omega-6 and omega-3, then omega-3 are much better in protecting us from the atherogenosis development. And therefore, what we want to have are oils that have the balanced ratio between omega-6 and omega-3. You need more omega-6, that's true, but there should be no so high excess omega-6 in the diet over omega-3. And that's the problem of, for example, sunflower oil or corn oil. They have a lot of polyunsaturated fatty acids, but there is very big predominance of the omega-6 family. For sunflower oil is the ratio 150 for omega-6 to 1 for omega-3. And the physiological ratio should be 5 to 1. So you can read at the sunflower oil that it's rich in polyunsaturated fatty acids. That's true, they are not lying. But unfortunately, dominant are the omega-6, and that you don't want to have. And if you look at the oils that have the balanced ratio, omega-9, omega-6, and omega-3, that's the rapeseed oil, olive oil, and the soybean oil. And therefore, we will still repeat to them in the recommendations, since they have the best ratio. And if they are taken in the good quantity, then they give the biggest benefit to us. Is this clear to you? Omega-3. Omega-3 are very, very good. They are anti-inflammatory. They lead to the production of compounds that reduce the inflammation in our body. They improve the lipid profile. We have two basic groups of them. The first, that's the precursor, that's the linolenic acid. The linolenic acid has 18 carbon atoms, 3 double bonds, and you can see, or you can find it, for example, in rapeseed, soybean, linseed oil. Second source of the fatty acid, of the omega-3 fatty acids, can be sea fish oil that contains these two fatty acids, typically eicosapentaenoic and docosahexaenoic acid. For our body, it doesn't matter if you have this oil or this oil, since alpha-linolenic acid can be converted to these two fatty acids. So if you have one of them in the diet, you will have the omega-3 beneficial fatty acids in your diet, in your body, and they can show the positive anti-inflammatory and anti-atherogenic effect. So therefore, what you are looking for is the balanced ratio between omega-6, omega-3, and that you typically find here in these three types of oil. The last are those that we call trans fat. As you know, typically the fatty acids have the double bond in the conformation cis. That's the conformation that's produced inside our body. If you put high temperature to these double bonds, or if you do the process of the solidification of liquid fats, you can isomerize these double bonds to the trans position. And problem is that these trans double bonds are much worse metabolized in our body, and we can say that you have very slow removal of these fatty acids from your metabolism. And they have very bad effect in result on your body metabolism. So it means that they, as you see, worsen your lipid profile. since they are only very slowly removed from the metabolism. Where you can find them? Before 20, 30 years, they were very frequent in the solid vegetable fats, for example, in the margarines. There were the plant fats, but unfortunately with high number of trans fat. Then there was very big restrictions, and nowadays the margarines should have below 1% of one fat. But you can still read that margarines are not bad, are not good, since they have a lot of trans fat. But nowadays the process is different, and there should be in those cells in EU below 1%. Unfortunately, still you cannot prevent the fast food for frying the things on very, very big temperatures. So if you eat some tasty fast food, French fries, potato chips, and all other things, you can be sure that sometimes there can be more trans fat that you would like to have.
What high temperature are we talking about? Can we reach this temperature in our home kitchen?
Typically, yes.
Like just frying with that?
If you have the fry pan with a lot of oil, you can do it, and you use bad oil. For example, the sunflower. So you can do it if you want.
But now with olive oil?
What?
Not with the olive oil?
I think that the olive oil is more resistant to it. Yes, but sunflower has a lot of polyunsaturated, that's bad. But you know, olive oil is also not ideal for cooking, no. In high temperatures. At high temperatures, the best thing is saturated fat with stearic acid, not with lauric and myristic and palmitic. You know, other thing is that if it's tasty, then you will eat it one per week and nothing happened, you know. This is only a recommendation.
So what is that? Like, is it better?
What?
Like the best fat to use?
I think that the best fat is the pig fat. It's called FAR, not SART. How is the... I must look at it. Each time when I want to tell this word, I forget it. It's the pig fat, the big one, the white pig fat that you... Yes, maybe this. Yes. SART. You know, each time when I want to tell this word, I forget it in English. Yes. So that's quite good. For it's only saturated fat, but it's not good in high quantities to eat it. If you must do it, then you can do it once a month. Yes, it's much better than use the olive oil for it, but only from the perspective of high temperature. Of course, that the other composition is better in the olive oil, but more trans fat can be produced if you have there the double bond. If you do not have it, then it's much more difficult to have the trans inside. So the best thing is not to fry. So no French fries. Last, trans fat you still have in the food. Since it's produced in GI tract of ruminants, that means our cows, if you drink milk or eat dairy products, you have there the trans fat also. Yes. So to have some amount of trans fat you have in the diet, the only thing is that you should not eat so much trans fat. And therefore it was very good that really the number in margarines was so decreased. So if you give me 2 more minutes, here is the list. So if we take all the recommendations together right now in year 2016-17, maybe even next year, the monounsaturated fat should consist or should form 10 to 15% of energy intake. So if you take as those 20-30% as the whole. So 10 to 15%, saturated fat around 7 to 10, with the predominance of stearic, and get rid of the lauric myristic. Polyunsaturated fat should form also 7 to 10. And what you want is the proper ratio omega-6 over omega-3, 5 to 1. Nowadays is typically much higher. And then the trans fat should form only 1%. So if we return here, the ideal fat is that has the balanced ratio omega-9, omega-6, omega-3, that are these three oils. If you use very high temperatures, then use the saturated fat for it. So, and then you can return to the normal life, and then you open the fridge and you want to cook, yes? But these are the recommendations that you should follow. Last are saccharides. Saccharides, they make the predominance of the energy, 55 to 60%. And what you should remember for them are two basic recommendations. First is that we should eat complex saccharides with a low glycemic index. Could you give me some example of these saccharides?
Starch.
Starch where? Starch is, for example, in pasta, and it's not so good if you have only the white pasta. Rice, some types of rice good, but the typical jasmine rice that we eat, it's not good. It has high glycemic index. That's slightly better. So typically is, for example, the porridge, yes, the oat meat, or the whole corn things that have the low glycemic index. So if you take the whole corn things that share this, for example, potatoes, they have high glycemic index, but still we eat them, yes, for they are cheap and everywhere. But from this perspective, they are not so good. And what should be reduced every time you can are oligosaccharides. Since oligosaccharides should be in the diet per day only 50 to 60 grams a day. Oligosaccharides mean also disaccharides, and that means also sucrose. So all person who drink normal Coke, Sprite, Fanta can simply calculate how many grams of sucrose in 1/2 liter bottle do they drink. And if you count this together, that you go to the pub and drink a beer where you have a lot of maltose, and that's also disaccharide, you know that the only good thing to drink is coffee with milk or water or tea without sugar. Yes? So here the recommendation is 50 to 60, but you can simply say that if you reduce it, then really no problem. Yes, for nowadays in the diet we have more oligosaccharides than we should. Big problem is sucrose, and then other big problem is that we eat especially the saccharides with a high glycemic index. So recommendation is low glycemic index and low content of oligosaccharides. Any question?
How can you do 1 calorie in a Coke Zero?
Yes. If I fly with Lufthansa, I also order Coke Zero.